Hi everyone, I'm Heather Wen, a retired nurse practitioner and the founder and practitioner at Arizona Healing Alternatives. On this channel, we'll be covering several videos, what I like to call aha moments or aha minutes, where we'll be discussing issues that impact your health. So whether you decide to use Western medicine, alternative medicine, or a mix of both, I'm passionate about you knowing what your options are. If you like what you see, please feel free to hit the subscribe button so that you can receive more videos of this type. For today's aha moment, we're going to be discussing anxiety, fears, and phobias. We're going to discuss what some options are ranging from Western medicine to alternative medicine, so stay tuned. So it's that time of year around Halloween where we should be having a lot of fun, going out, there's trick-or-treating, all sorts of different parties that happen around Halloween. But what if you suffer from anxiety, fears, or phobias? For people who suffer with those issues, it can seem like Halloween is year-round and not a lot of fun. So what do you do now? Well, there are different options, so let's look at the first one. Let's look at Western medicine. In Western medicine, what I always tell people is sometimes a good place to start is getting panels and blood work. I know that sounds kind of odd, but let's look at it. When you go in, there are many people, and I know in my practice when I was practicing as a nurse practitioner, I would find that there would be people who would be between the ages of about 43 and 53 in that perimenopausal range that all of a sudden would tell me, oh my gosh, I'm having a panic attack. I've never experienced anything like that before. Well, when we run blood work, sometimes there's a hormone imbalance that could be at fault for that. It may not be a trauma or anything else. It could simply be a hormone imbalance. And this can happen with men as well, believe it or not. Men can also have hormone imbalances. So there's also thyroid issues. If you run panels and look at thyroid issues too can change the heartbeat and make it go really fast, which can make you feel more anxious. So I always tell people rule out those situations first. Then if it does happen to be a trauma or something else that's happened in your life, that's when you want to look at things in Western medicine like psychiatry, psychology, counseling, life coaching, things like that. In psychiatry can be good for medications. There are many medications in Western medicine that can help with anxiety, and some very, very good ones. And it used to be that psychiatrists would do both the counseling and the medication part. These days, more likely, psychiatrists are doing more of the medication management, and psychologists or life coaches or therapists are doing more of the talking part of it. But there are some that do both, so you can look into those things. What's nice about those type of things in counseling is that you identify the issue that's going on, and then they can give you tools for what you can do on a daily basis to try to help relieve those anxieties or fears and phobias. So that would be in the Western medicine realm. Well, what if you don't want to do Western medicine? There's other options. As a second option in alternative medicine, you can look to naturopaths. Naturopaths, if you don't like taking medications, let's say, are experts at looking at different supplements and things that you can use in place of and sometimes in conjunction with Western medications. And they're usually the experts at that and in different ways to treat that. So naturopathic options are good, as well as homeopathic options. Many naturopaths also have homeopathic training as well, or somebody who just specializes in homeopathy. It's a way of taking something to help you feel a little bit better and help curb that, the feelings of anxiety. There's that. There's also acupuncture and herbs that can also help with anxiety and panic attacks, and different Chinese herbs that can be used. I find that naturopaths tend to use more of the American type of herbs, and those that are specialized in acupuncture and herbalists, they're mostly into Chinese medical herbs. So there's that as a possible option. The third option would be something called muscle testing or applied kinesiology, and that can be used to actually test a muscle in your body, access the neurological system of the brain to find out the specific issue, where it started, what age, what emotions were attached to it, and then reprogram the nervous system to have a relaxation response instead of a stress response. And that can be a way to go as well. The last option I'll talk about is hypnosis. Hypnosis is a very important tool that can be used very successfully with anxieties, with fears and phobias. And that's a way of allowing the practitioner to work as the conscious mind telling the subconscious brain to relax in those situations and to do things differently in those situations to avoid the panic or anxiety. So now you've heard some different options for what you can possibly do for anxiety or fears or phobias, ranging from Western medicine to alternative medicine. And what's interesting is when you know what your options are, you can also use a mix of several modalities at the same time to find the proper balance so that you can live anxiety-free and enjoy your Halloween this time around. If you've enjoyed this video, please feel free to hit the subscribe button. Also, with that subscribe button, you can hit that notification bell so that anytime a new video comes out, you'll be able to get notified and be able to see it. Wishing you a wonderful and happy Halloween. Thanks for listening.